most common option is what's called cognitive behavioral therapy. So that's where we teach kids that our feelings and our thoughts and our behaviors are all interconnected. And I usually explain to kids, you can't decide how to feel, but you can decide how to think and you can decide how to act, and that may impact how you feel and help you feel better. And so we teach them, coping skills that they can do to help themselves feel better. And then we teach them, questions to ask themselves in order to help reframe their thoughts in a more positive way. The other option, if therapy is not working, is medication. The most effective treatment is to have therapy and medication combined. But if you're only going to do one thing, that would be therapy. One thing that happens with anxiety is we tend to avoid, and when we avoid, our brain learns that what we avoided is actually scary, so then we're more anxious going back into the situation again. And a lot of parents, in order to help their kids feel better, kind of reinforce that avoidance or allow it, to happen. Think about, okay, how can I encourage my child to go just a little bit outside of their comfort zone? So we're challenging that avoidance, right? So if they, don't want to talk to people, maybe encourage them to just say hello to the person at the checkout counter at Kroger, right? Because, that person isn't going to be rude back. They're in customer service, perfectly safe to say hi to them. The other thing I think as parents we do a lot is we want to fix, and we forget that we need to take a step back and validate and acknowledge emotions. So sometimes just saying, I see you're anxious, I'm sorry you're going through this, I see this is really hard for you, and just leaving it at that will help reduce the emotion. Whereas if you're like, you need to do X, Y, and Z and blah, 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 then the adolescent is like, no, I don't, what are you talking about? One thing is if your teen has a phone, sometimes it's easier to communicate through text than that face-to-face verbal conversation. So you can text them, I'm just with what you've observed, right? So I've observed this lately, I'm concerned about you, and kind of leave it open-ended, right? And give them the opportunity to respond. Other ways include, when you're driving in the car with your teen, for example, that's a time I think, to bring up, hey, I've been kind of concerned about you lately, as long as you think it's not going to escalate into like somebody crying or really angry, because that's probably not a safe driving situation. But I think, sitting next to somebody and having a conversation sometimes is a little less threatening and less intense than being face to face. Maybe you have a regular habit of like having a game night or something, right? And you play a game together, and I think that allows the opportunity for conversation to occur in a way that doesn't feel like invasive or threatening, right? So, the less intense, the more likely I think, a teen is going to be to open up. One option is to take them, to the emergency department, and an evaluation will be arranged for them that way. You should contact your school counselor, and they'll be able to help coordinate an assessment, either on the school site or, with an outside agency. If they have a therapist or pediatrician, that's, take them to the therapist or pediatrician, and they should be prepared to be able to follow up on that concern as well.